In the last 2.5 months, the CDC has confirmed 8 cases of locally transmitted malaria. There are 7 cases in Florida and another in Texas. Infected mosquitoes spread malaria. Health officials report close to 300 million cases worldwide each year, with 95% of them in Africa. So this is the first time in 20 years the U.S. has cases in which people were infected here in the country. The Fox Medical Team's Beth Galvin has the latest.
With international travel once again picking up and hot, humid temperatures baking much of the country, the CDC is tracking 8 rare cases of locally transmitted malaria, 7 in Florida, another in Texas. Dr. Danny Brandstetter is medical director of infection prevention and infectious diseases at Wellstar Kennestone Hospital.
It's something to take note of. Overall, the thought is that the risk of infection for malaria in those areas still remains quite low for the general population.
Before the pandemic, the CDC says the U.S. was averaging about 2,000 cases of mostly travel-related malaria a year. About 300 were severe, with 5 to 10 people dying from malaria. This is the first time, though, in 20 years the U.S. has had a cluster of cases not linked to international travel. The parasite that causes malaria is spread through a bite from an infected female Anopheles mosquito.
A mosquito must bite an infected person and then subsequently bite another person to transmit that infection. And that is how, from one person to the other, malaria is transmitted. It is not transmitted human to human through contact.
To protect yourself, the CDC says do what you can to avoid mosquito bites. Use an EPA-registered insect repellent with active ingredients such as DEET or picaridin. Wear loose-fitting long-sleeve clothing that covers your arms and legs. Avoid being outdoors at dawn and dusk when mosquitoes are most active. Get rid of standing water around your house and repair any broken screens that you have. And the CDC is urging doctors and public health authorities to be on the lookout for patients with malaria-like symptoms.
It is fevers, headaches, muscle aches, chills, and may have some nausea. A more advanced illness may have some yellowing to the eyes. And some confusion and difficulty with dark urine.
And because malaria can be serious and potentially fatal, seek medical care quickly if you have symptoms.
We are not seeing vast outbreaks of malaria, hundreds or so people, for example. We are not seeing that, and that is not anticipated to be seen at this time.
For your Fox Medical Team, I'm Beth Galvin.